Dr. J, I'm happy to work with CardioVisual and all the amazing educators to this month talk about sudden cardiac death and particularly in hypertrophic cardiomyopathy. Hypertrophic cardiomyopathy, as you know, is a genetic cardiomyopathy in which you have an increased thickness of the ventricle. As such, this leads to myocyte disarray and fibrosis, increased risk of having ventricular arrhythmias. These include non-sustained VT, ventricular tachycardia, or ventricular fibrillation, which can lead to sudden cardiac death. Let's go over some of the risk factors for development of sudden cardiac death in hypertrophic cardiomyopathy. This diagram nicely summarizes how to assess risks for sudden cardiac death in hypertrophic cardiomyopathy patient. This is from the 2020 guidelines for hypertrophic cardiomyopathy. So first of all, if a patient has sudden cardiac arrest, patient gets an ICD. For a secondary prevention, we'll try and prevent the next one. If they've not had a prior event, then you want to look for any risk factors, right? Risk factors include family history of sudden cardiac death, massive LVH, unexplained syncope, apical aneurysm, or ejection fraction less than 50%. If you have none of those, then IC may be reasonable. That's a 2A recommendations. Let's say if you have none of those risk factors, but you have non-SVT, then if they do have it, if they're a child, which have a higher risk of having arrhythmias, then you can consider it. If they're an adult, then it's a lower recommendation 2B. What if they don't have NSVT and you do a cardiac MRI and you have late gadolinium enhancement? Yes, then ICD may be considered as well too. That's a 2B recommendation. Now, if they have none of these risk factors, don't have NSVT, don't have the high risk profiles, or don't have any MRI that's abnormal, ICDs are not recommended. Hope you found this helpful. Next up, we're going to have Heart Charge, which is going to talk about their personal journey with this condition and their journey to get an ICD.